gentlemen of the press, I am addressing you today on the coronavirus COVID-19 pandemic that has destabilized economies and the social existence of many countries in the last 4 months. COVID-19 has finally found its way into our country, and reports reveal that there have been an increase in the number of confirmed cases. In Edo State, we have developed an action plan to cope with this pandemic. The postponed National Sports Festival Edo 2020 gave us the opportunity to put in place a contingency plan. We have 3 isolation centers in Benin City, Iroa, and Auchi, a federal government testing center in Iroa, and a large number of well-trained and certified health workers to treat and trace patients. Coronavirus is not a death sentence, so there is no need to panic. With swift identification and proper management and care, many persons who have been infected with the virus have made full recoveries. If we all work together and take the right precautions, it is possible to cope with this virus. As you are all aware, the common signs and symptoms of coronavirus infections include dry cough, fever, and difficulty in breathing. Since COVID-19 is a virus that is transmitted from one person to another through close contact, the most effective and proven remedy is to reduce its spread is through social distancing. Social distancing involves reducing as much as possible physical contacts with others. The government of Edo State, therefore, advises that from today, 23rd March 2020, every citizen should practice social distancing to prevent the coronavirus from spreading in our state. In order to give effect to our social distancing policy, gatherings of more than 50 people are prohibited in Edo State until further notice. All schools are to remain closed in Edo State until further notice. Public transportation will remain in operation. However, crowding in commercial vehicles should be avoided. All public officers below grade level 12, except those providing essential services such as fire and healthcare, should work from home until further notice. Citizens are advised to postpone unnecessary travels in and out of the state, and if possible, stay at home. If you know of anyone who arrived from Europe, the Americas, or Asia in the last 30 days, please give details of such persons, including their phone numbers, so that we can provide screening and any required support to them. You should call the following numbers: 0808 409 6723, 0806 425 8163, 0803 583 5529, 0807 413 2019. If you or any relative of yours has any signs and symptoms of coronavirus, please report to the nearest designated hospital. These are Central Hospital, Edo Specialist Hospital, and Stella Obasanjo Hospitals in Benin City, Iroa Specialist Teaching Hospital in Iroa, University of Benin Teaching Hospital, and Auchi General Hospital, so that these persons can be monitored, tested, and treated. The Edo State government is very interested in the health and welfare and social support for the very vulnerable in our society, particularly the elderly and persons with chronic diseases. If you know of any of these persons in this category who may be ill, kindly call and report to the numbers which I listed above. The Edo State Task Force on COVID-19, which is headed by me and made up of prominent leaders in the state, will meet frequently to review and update the situation. As you go about your daily activities, apply extra caution, such as washing your hands regularly with running water and use alcohol-based sanitizers. As we face this challenge, I call on all Edo residents to remain calm and cooperate with us and ensure that you follow the instructions and steps which we have outlined to curtail the spread of COVID-19. Be rest assured that your government will provide the required leadership and support to check this pandemic in Edo State. I thank you, and God bless the people of Edo State. You would have heard from the news media that since Friday last week, since I came back from the National Economic Council meeting, we've been having consultations with a wide spectrum of people and leaders in our community. I had the privilege of hosting in this hall all senior religious leaders from CAN, all the pillars of CAN and the Muslim associations. And this is what we discussed. How do we get the message to the grassroots? How do we sensitize our people? And I'm glad to inform you that the feedback and from our religious leaders is that they were going to take the message home down through their congregations across the state. We also had a very unique meeting where His Royal Majesty Monabadendo Ukwakolokolo Oba Ewai II personally came here as chairman of the Traditional Council of Edo State with all, all monarchs representing the entire state. On Friday, we had the same briefings and the same sensitization with them, and they gave us their assurance and they gave us their words that they were going to take the message down to their domains and members of their communities. We also had meetings with our political leaders from across all the 192 wards, and the message was sent through. Immediately after this meeting, I'm having a special joint ESCO meeting with the chairman of the local governments in Edo State, and the same message has been sent down to our people. One of the reasons why we decided to have this press conference and invite all of you is that we feel that as members of your profession, you have a very, very significant role in disseminating this message. And so my call on you today, I'm sure many of you, in terms of your editorials, in terms of your, disseminating information, particularly radio stations and television stations. I know you already have this as public service announcements. My plea to you is that you should increase your slots significantly to disseminate this message to members of the public. I hope that you will heed our call, and please, whatever you can do to send the message down as quickly, as fast, and as accurately as possible, I hope and I'm trusting that we will have your cooperation. And this is to also appeal to owners of businesses, such as banks, market associations, in fact, people who run businesses and public spaces, to ensure that they all procure hand sanitizers and have water and washing facilities in front of their premises, particularly markets.
Yes, indeed, we do have a patient that was confirmed to be positive in our laboratories late yesterday, presently under isolation, and we do expect that we'll get better.